Students have access to a range of teaching aids which they can use in order to develop their clinical skills.
You're prepared for it by being brought into simulation rooms where you're seeing women in the positions you'll find them, you're using the equipment that you're going to use while on placement, and then simulations help to prepare you for the actual thing.
Studying social work at Teesside means that I will have the voice and the confidence that I need to go out and enable people to take control of their lives.
It's important for the reputation of the programme and the credibility of students and protection of the public that our courses are accredited by the Healthcare Professions Council.
On campus we have our own mock theatre that's been designed with real anaesthetic machines, real instruments, in an environment that's exactly the same as a theatre in any surgical environment around this area.
It's a good chance to get your hands on and practice and make mistakes while you're in a mock environment, because when you are in theatre it is moving at the theatre pace, so it's a good place to practice and make mistakes.
Within physiotherapy here at the university, we're fortunate in having a really large open plan teaching room which gives us a huge amount of flexibility. We've got all our small apparatus here, we've got our skeletons and our anatomical models.
Having access to the facilities within the university really prepares you to apply your skills when you're on clinical placement, wherever your placement may be.
This is a typical nursing skills lab, which is set up, as you can see, just like a ward would be set up. So there's lots of bed spaces and the students would be learning how to care for patients within these beds.
Nothing prepares you really for getting out into practice, but it's nice to have an idea of what to expect and what's expected of you when you get out there.
One key facility we use at the university for developing communication and interpersonal skills are these interaction rooms. Mental health nursing is all about developing that relationship, being a person, being yourself and being able to interact with other people and see how they impact on you and how you can impact on them and make a difference in their life.
We obviously have an X-ray room, and it's a large X-ray room, so we can get quite a lot of students in at any one time. But beyond that, we have this image database, which has about 1 million images in it. We have the computer simulation equipment, which allows us to have over 20 X-ray rooms simulated on computer screens.
I've used it from day one, and I believe it's given me the skills, the confidence to treat real patients in a controlled environment.
So we pretty much have a wide range of spectrum, and the students really want for very little.
Teesside University was the first university in the country to actually deliver specialist point-of-care ultrasound training to actually doctors and other healthcare professionals.
I initially trained in radiography because I had an interest in ultrasound, and then when an opening came up in the department to train, I jumped at the chance.
Studying dentistry at Teesside is fantastic. We've got state-of-the-art facilities, both in the student dental clinic but also in the Phantom Head laboratory. With Teesside, you're provided with a dual qualification, so you're a dental hygienist and you're also a dental therapist.
One of the innovations we've got on the Teesside Occupational Therapy programmes is that all of the students will undertake a placement in a place where an occupational therapist doesn't currently work, and they'll have to think about how an occupational therapist could actually develop a project in that area, and that allows the students to be quite autonomous.
Teesside has given me all kinds of support, support in my clinical skills, in my personal skills, and also in showing me that there's a big wide world of occupational therapy out there. They've really shown us what we can do with our skills and that really the world's our oyster.